there, my name is Jennifer. I'm going to be your nurse today. I'm going to go wash my hands real quick before we get started. Okay, can you tell me your name and date of birth? All right, this is Jerry Carter. We were born on March 11th, 1981. A little health history of Jerry. He is a 39-year-old male coming with respiratory distress. We are currently have a COVID test pending. Our current vital signs are a temperature of 100.6 post-ibuprofen given, a pain score of 2, a heart rate of 94, and a blood pressure of 164/81. Jerry, today I'm going to do a head-to-toe assessment. We're going to start with a neuro assessment. Can you please smile for me and frown, wrinkle your forehead, and puff out your cheeks? Great job. Those were all normal and equal bilaterally. This is a test of cranial nerve number 5, the facial nerve. Next, I'm going to place my hands on the side of your jaw and have you open and close your mouth. Good job. Motor function of cranial nerve number 7, the trigeminal nerve. Next, Jerry, I'm going to use a Q-tip to touch your face, and I want you to tell me if you feel a sharp or a dull sensation. Dull, sharp, dull, sharp, sharp. Awesome, Jerry, that was great. Everything was completely normal there. Patient was able to identify 100% of the time dull and sharp sensation. Sensory test of cranial nerve number 7, trigeminal. Next, Jerry, I'm going to have you get up for me, and we're going to do a motor function test. I'm going to have you walk toward the door and back. All right, and walking toward the door. Normal gait. Hands are swinging opposite of the leg. Good balance. Heel strike walk. Awesome, Jerry. You can have a seat for me. Next, I'm going to have you place your hands on top of your thighs, and we're going to flip our hands back and forth as fast as you can for me. Great job, Jerry. Awesome. Jerry was able to do that fast and equally, no issues there. Next, Jerry, we're going to have you touch your nose and then reach out and touch my finger. Awesome, Jerry. Next, we're going to have you touch your thumb to each of your fingers, and I want you to do that as fast as you can, back and forth down your hand. Great job. And finally, I'm going to have you take your heel and run it down the shin of your opposite leg with your eyes closed. Can you do that for me? Great job, Jerry. Those are all motor function tests. This is a test of the cerebral area of the brain. Awesome, Jerry. Next thing I'm going to have you do is I'm going to test your deep tendon reflexes. So I'm going to start with your bicep. On both sides, I'm going to check them bilaterally, okay? Great. Awesome. And now the back side of your elbow, the tricep. Awesome. Those were both 2+ and equal bilaterally. Next is brachioradialis. 2+ and equal bilaterally. Next, I'm going to have you sit on the side of the bed, and I'm going to test your patellar or quadriceps reflex. Awesome. Those were both 2+ and equal bilaterally. Last, I'm going to do your Achilles on the back of your heel. And those are both equal and 2+ bilaterally. Those are all deep tendon reflexes. Next, I'm going to do a superficial reflex. Jerry, I'm going to run my finger down the bottom of your foot. It may tickle a little bit. And our toes curl on both sides bilaterally. Great job, Jerry. Next thing I'm going to do is a quick assessment of your lungs. Jerry, I do see that you are on a nasal cannula, and that is currently running at 2 liters per minute. How are you feeling on that? Pretty good, awesome. All right, I'm gonna have you just sit there. I'm gonna lower your shirt for just a few minutes and look at your chest. Skin is pink, no visible lesions, and some mild intercostal retractions are noted. All right, Jerry. Next, I'm going to do a palpation of your chest. I'm going to put both hands around your rib cage here. Can you take a big, deep breath for me? Inhale, exhale. Great job, Jerry. Thumbs move out equally bilaterally. Noticing the shape of the patient's chest, we are a cone shape, meaning it's wider on the top than it is on the bottom. A transverse view, we're an oval shape, and the AP to transverse ratio is approximately 2 to 1. Our sternum is midline. All right, next thing we're gonna do is a palpation of your chest, noticing any masses, lesions, anything like that, any discomfort. Let me know, Jerry, okay? No discomfort? All right, no masses or anything noted. Next thing we're gonna do is a palpation of your chest. Noticing resonance intercostally. Noticing dullness over muscle or breast tissue. And flatness over muscle tissue. Great job, Jerry. Next, I'm gonna have you say 99 for me. I'm gonna place my hands on your chest and notice any crepitus or any vibrations. Can you say 99? And again, and again. Again, please. Again, and one more. All right, Jerry, I am noticing a little bit of some rattling down in the lower lungs. Next, I'm gonna go ahead and listen to your lungs. I'm gonna grab an alcohol wipe real quick and clean off my stethoscope. All right. Big deep breath. And again. 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 Great job, Jerry. I am noticing some crackles down in the lower part of your lungs. Next thing we're going to do is a assessment of your posterior lungs. So I'm going to go ahead and put your gown back on here, and I'm going to help you sit up a little bit, and we're going to do the same thing kind of on the back, okay? Great job, Jerry. Okay, so coming around to the patient's backside, we are pink, no visible lesions. Everything looks midline with the spine. Next thing we're going to do is palpate. Great job, Jerry. Same thing as before. I'm going to have you say 99, 99, 99, 99, 99, and 99. All right, Jerry. Next thing I'm going to do is go ahead and listen to your lungs. Take a deep breath for me. And again. And again. Listen to the outside or sides of your lungs. Deep breath. Very nice, Jerry. I am still noticing some crackles and a little bit of wheezing toward the bottom of your lungs. There is vesicular sounds toward the outside, some bronchovesicular sounds toward the midline, and some bronchial sounds up toward the top. All right. Next, I'm going to lay you down just a little bit here, Jerry. And I'm going to palpate your carotid arteries on both sides, and I'm going to listen to them. All right, Jerry. Feeling on one side. Carotid artery is a 2+. And a 2+ on the other side. Next, Jerry, I'm going to go ahead and listen to your carotid artery with the bell of my stethoscope. When I do this, I'd like you to hold your breath for just a second. I'm listening to make sure that there's a good, clean sound with that carotid artery. And hold your breath for just a second, please. Great job. Take a breath. We're going to do the other side now. Great job, Jerry. You can breathe for me. All right. I am noticing that there is no bruit. Neck vessels are a 2+. Next, I'm going to go ahead and listen to your heart. So I'm going to pull down your gown again. I'm going to try to listen to 5 points on your chest. We're going to listen to the aortic, pulmonic, Erb's point, your tricuspid, and mitral locations. So let me clean off my stethoscope once more. I'm going to listen with the bell and the diaphragm this time. Warm that up just a bit for you. And listening with the bell for any extra sounds or murmur. Great job, Jerry. I'm going to help roll you onto your left side and listen for that murmur once more. Okay, Jerry. There's no extra sounds or murmur noted. It's a normal rate and rhythm with a heart rate of 72 and a normal rhythm. Great job, Jerry. I'm going to help sit you up just a tiny bit here and cover you back up. Great job, Jerry. Next, I'm going to go ahead and feel your pulses bilaterally. Radial pulse, brachial pulse. Good job. Inside your ankles here. And feel pulse the tops of your feet. Great job, Jerry. Those are all 2+, no abnormalities found. Next, I'm going to go ahead and do an assessment on your abdomen. So we're going to lean back just a tiny bit. Go ahead and lift up your gown for a second. Jerry's abdomen is pink, no lesions noted. Umbilicus is midline with no abnormal movement. All right, Jerry, next I'm going to go ahead and listen to your bowel sounds. I'm going to listen in all 4 quadrants, starting in the right upper. And I'm going to listen for 30 seconds or until I hear bowel sounds and then move on. Great job, Jerry. Normal bowel sounds are noted. Next, I'm gonna go ahead and palpate your abdomen, starting in the right upper quadrant. We're gonna start with light palpation. Let me know if you have any uncomfortable moments here, please. And next, a little deeper. Great job, Jerry. Next, I'm gonna go ahead and percuss. Noting resonance in all 4 quadrants. No discomfort with palpation. Next, I'm gonna go ahead and try to palpate your liver. If you can take a deep breath for me, I'm gonna do the hook method and push my fingers down around the ribcage just slightly and take an exhale for me. All right, and I'm not able to palpate the liver. Next, we're gonna do the kidneys. Take a deep breath for me, inhale and exhale, and that's a hand posterior and inferior to the kidney. We're gonna go ahead and do the kidney on the other side. Deep breath for me, Jerry. And last, in the right upper quadrant, I'm gonna try to feel for your spleen. Deep breath, inhale and exhale. All right, Jerry, I was able to palpate your kidneys on both sides. I was not able to palpate your liver or your spleen, which is normal. Finally, I'm gonna have you sit up. Do you have any pain or need anything at the moment? All right, Jerry, with those light retractions that I am noticing, I'm gonna go ahead and call the doctor and let them know that on your 2 liters of nasal cannula, you're still having some mild retractions and crackles. We are still waiting on your rapid COVID test to come back. So you'll be in isolation until we get that back. But all of your other head to toe assessment seems fairly normal. Everything checks out. Do you have any questions or need anything at the moment? All right, I'm gonna set your call light within reach and put back up your bed rails. Thank you, Jerry, for your time. I appreciate it.